welcome everyone that's joining the Support Hub for interview crash course in medicine and dentistry. We have 5 speakers with us today to talk about that. We'll be talking about different types of interviews, skills that may be required, and common questions. If the speakers would like to give a brief introduction of themselves, that would be great. Thank you.
Everyone, my name is Afia and I'm a third-year medical student at Barts and London, and I am the co-president of SAMDA. We'll just go around and introduce ourselves.
I'm Gaeun. I'm a third-year dental student at Barts, and I'm a dental representative for SAMDA.
Hi everyone, I'm Habiba. I'm going into my second year of medicine and I'm the rep for SAMDA.
Hi everyone, my name is Padma. I'm going into second year dentistry and I'm a liaison officer for SAMDA.
I think Kong, you're muted. I think, do you want to try again?
Introduction.
Yeah, I think Kong is having mic issues.
Okay.
Kong, are you able to unmute yourself? No?
Can you see the mic button at the bottom of the screen? And you're clicking on it and it's not working. Okay, bear with me 1 second.
Join, and hopefully it works by then, yeah.
Okay. Okay. Just give him a minute to rejoin. Someone's asked in the chat while we wait, what is SAMDA?
Good question. I'll just get started then. So SAMDA stands for Student Assisted Medical and Dental Application. We are a widening participation volunteering group based at Barts and London. And as the name suggests, we support highly motivated sixth form students from local state schools towards a career in medicine or dentistry. And as we're a widening participation group, we focus our efforts in helping students from underprivileged backgrounds in East London. Having said this, due to the pandemic, we have transferred all our activities online and our reach has massively increased. We now have audience from all over the world. And we provide prospective students with guidance on writing the best personal statement, as well as preparation for entrance exams and interviews. On the slide, you can see many other events we hold throughout the year. For example, our virtual work experience, which was very popular this year. We're able to hold school visits thanks to the commitment of our volunteers, and also our clinicians evening, which is taking part this coming week, Tuesday, the 13th of July. This is an event where newly graduated doctors and dentists, they were coming in and deliver talks on their career pathway, life as a medical dental student, and we'll also be going through the medical and dental application process. So that's just what we do in a nutshell. If Kong is here, we're ready to start.
Is your mic working now? Any luck? Hopefully your camera's working as well.
Just starts that it's still not working, but I think he'll get that sorted, and his part is quite in bronze, so I think we can start.
Right.
That sounds good.
Okay, so What is the plan for today? Well, you have come here to get an insight into the medical and dental interviews. We'll be covering the different types of interviews, common questions and themes, ethics, hot topics, and we'll also be doing some role play. So without further ado, I'll now hand it over to Habiba, who will be speaking about the different types of interviews.
Has the slide changed? Yeah, perfect. Okay, so there are two main types of interviews for medicine and dentistry, being multiple mini interviews and panel/traditional. So for multiple mini interviews, or otherwise known as MMIs, you rotate through different stations, each asking one question. There might be some follow-up questions, but there's like a main overarching question that's the theme of the station. These questions really vary in content. It can go from building something out of Lego to just simply why medicine or dentistry. So be prepared to be unprepared. So you will have a different interviewer for each question/station, and each station should last about 5 to 7 minutes. And the number of stations vary between medical schools, but I'd say roughly about 6-7 stations is a normal standard. Then there's the panel/traditional interviews, and these are just kind of your more standard format. There's 4 interviewers that are the same throughout the entire interview, and they all ask you a load of different questions, and it'll last about 15 to 20 minutes roughly. Now, I know with COVID, everything has changed, and so has medical and dental interviews. So most likely these will be conducted online, but obviously keep on checking your medical schools and what, well, aspiring medical schools anyways, what they're doing with the interviews, but it will probably be online via Zoom, Blackboard, or Microsoft Teams. And breakout rooms will probably utilize the breakout rooms, MMIs will utilize the breakout room feature, sorry about that, and traditional interviews will probably just be a normal video call, which is what you're used to. Next slide, please. So this is just the different medical schools in the UK, and it's just for medicine and dentistry and which ones offer which type of interview. So if you want to take a picture of this really quickly. And I will now be handing over to Padma.
To unmute yourself, and then can you start again, please?
So I'll be talking about why medicine or dentistry, which is one of the most common questions that you can be asked. So the key thing here is to give a personalized answer. So you can talk about what you like about the profession, what skills you have that will be useful in the career, such as those that you've gained through extracurricular activities. Talking about memorable scenarios from work experience or volunteering really help to make your answer personalized. So when talking about these, try to explain why these scenarios stood out to you. And understanding about the demands and challenges of the profession helps to show the interviewer that you have a realistic understanding of what you're headed towards. So, for example, a challenge could be aggressive patients, and you could talk about how you would use your strong communication skills and empathy to handle this. Okay. So an example question is, what is the MDT and who is the most important member? So for these types of questions, it's important to think out loud so that the examiner can see your thought process. And so MDT stands for multidisciplinary team. So if you think about a hospital setting, that can include doctors, nurses, receptionists, canteen staff, cleaners. So it's important to mention their interdependence and how they all contribute equally according to their area of expertise. And they're all needed to provide the best care for the patient, which is the ultimate goal. And it's also important that staff work within their capabilities. So if they think that something is beyond their capability, then there is a strength in recognizing that and asking another member of the team to help out in the best interest of the patient. And also lastly, remember to just stay neutral and say that no one is more important than another. So when it comes to questions about your personal statement, bots have a copy of this during the interview, so you might be asked to elaborate on something, so make sure you know what you've written quite well. BMAT unis get a copy of your essay and UCL go through it during the interview, and just be concise because the interviewer might be wanting to ask you a follow-up question, so make sure you leave some time for that. Insight into the profession. it's good to have some basic insight into medicine or dentistry, including its history, the history of the NHS, latest news, and key organizations like the ones on the slide. So the GDC, for example, stands for General Dental Council, and they actually, if you do some research, you'll see they have 9 principles about how dental professionals should conduct themselves. So if you're familiar with the principles, you can actually use these to support some of the things that you say in your answers in the interview. And it just shows that you've done your research and that you're a deserving candidate. And now I'll hand over to Gaeun.
Going to why this course, another common question to university. And this question wants to see like what attracted you to this university out of all the other medical and dental schools, and how much you have actually researched into their uni. So it's really important to do your research into like each uni and then like structure your answer beforehand. So when selecting which university to apply to, find about where the university is located and whether you're happy to live out or to commute from home. So I personally wanted to stay in London, and I was quite happy to commute while staying with my family. So that was the big reason why I chose Barts, which is in London. And I actually mentioned this point to my interviewers, and they were very convinced by it as well. And also another big factor when choosing a university is the whole like atmosphere of the uni, so like the vibe of the uni. So you can get this idea by going to like open days, talking to like current students that are studying there. So one of the many reasons why I wanted to go to Barts is that I really liked how friendly everyone was, like not just the students, but like the tutors were really nice, and they were really passionate about what they do. And also the pastoral care that Barts was providing really attracted me to Barts, because like dentistry and medicine is a very difficult degree, and at some point you will need help to get through everything. So, and then I felt that Barts can really provide this support and care for their students. So that's like, so there are many reasons that you can tell the interviewers why you chose that uni. And also different universities have different course structures and teaching styles. So some may be more problem-based learning, or more traditional, so like more lecture-based, or it could actually be integrated. And since everyone has different ways of learning, knowing what type of a learner you are is really important to find which course structure would suit you. So you could easily find this information by going onto the university website, and also look up any other opportunities like hospital placements, how early the patient contact is, any opportunity to get involved with research, or any like intercalation as well. As well as the academic aspect, you also need to look into the social aspect of the uni. So dentistry and medicine is not just about studying. So like you might feel that, but that's not what the university wants you to do as well. So it's really important to show that you're a well-rounded student who can balance work and life, avoid burnout, and also make the most out of your opportunities at uni. So really find out about what sorts of societies there are, like how you could take part, as well. So like you could also mention about like the hobbies and like skills you have at the moment, and how you would like to continue that in a society. Not only societies, you could also mention things like any charity or volunteering opportunities that are available in uni as well. So while it's a good way to show that you're enthusiastic about coming to this specific uni, but it's not just about flattering the interviewer how this is the best uni ever and just going on and on about it. It's more about how you actually took your time to research into different unis to find the best match to you. So yeah. Padma's going to be talking about STAR method as well.
So the STAR method is basically a method of structuring your answers when you get asked a question asking you to describe a time in the past. So for example, a time you demonstrated empathy. So first you would explain the situation. So perhaps like, for example, your friend was nervous before a test, then what the task was, so which was to help your friend. then what action you took. So maybe you asked her what topics she's finding hard, you helped her to create a study timetable, you kept checking in on her and supporting her. And lastly, the second last is the result, so actually, the outcome. And lastly, and probably most importantly, is reflection. So you could talk about what you think went well, and what you think you could improve for next time. And this is so important because it shows you are proactive and that you learn from your experiences. So now, guys, when you get asked about your skills, don't be shy, because this is your opportunity to convince the interviewer that you deserve that place in medical or dental school. So feel free to take a picture of the slide. I'm just going to go through it briefly. So by mentioning your hobbies or extracurricular activities, you can talk about the skills that you have developed through them, like communication skills, perseverance, time management, and you can also mention roles of responsibility that you've taken on, like house captain or prefect, and what you've learned from there. And on the right-hand side, you can see examples of questions that you could be asked. So, if you get asked, like, how do you cope with stress? Never say things like, oh, I just don't tend to get stressed or something, because it's quite a natural thing to feel. And you could say that maybe you go for a walk, maybe you talk to your friends, maybe you play a sport, you do singing or dancing, anything, maybe you read a book. And since, medical or dental school can be quite stressful at times, the interviewer basically wants to see that you have a mechanism to cope with it. So yeah, just have a think about these questions, and of course, to remember to use the STAR method when you have to describe a time in the past, because it's a great way of structuring your answers. Yeah, and I'll hand over to Habiba.
Okay, so a type of question you can get is like a description or a problem-solving question. So an example is here, and what you need to do with this type of question is you state what the graph is of, make sure you say what the X and Y axis are showing, and include the units that they're in. So for instance, with this one, you can see that the X axis is mentioning that you can see that, even though it might seem kind of redundant, make sure you say it. And then you describe the pattern or the trend. So there may be follow-up questions asking you to explain why the graph is this way. So just be prepared for that to be asked. Next slide, please. And here's an example of a description question. It could literally be just a picture of a park like it's here, or just a picture of a busy street. And this is kind of assessing your level of communication and being able to convey what you're observing. So look at the big picture, kind of describe the setting, the weather, describe it in a logical order. So from top to bottom, left to right, divide the picture into 4 quadrants maybe, the foreground, middle ground, background. Just make sure you go in a methodical order so that you're able to describe almost everything, and that it's a clear line of thinking that you're able to show the interviewer. Why you were asked to describe the picture, and I kind of gave you a couple of reasons now, so just keep that in mind.
Now moving on to the ethics, and the ethical questions usually be on these 4 pillars of medical ethics. So I'm going to kind of talk you through the important parts of the 4 pillars. So first of all, we have beneficence. Usually we simplify it to more than that. It's actually doing much for the patient. So what that means is that there will be a range of treatment options that you can do for the patient, and then you have to rank them from the worst to the best, and then explain all these options to the patient. So that's the general idea of beneficence. Next, we have non-maleficence. Now, non-maleficence is not doing harm, and it can be quite similar to beneficence in the sense that beneficence is good and non-maleficence is not doing bad things. The difference between them is that non-maleficence is more about having a you should do to the patient. So if something is going to cause more harm than good, then you should an option. About talking about all the possible options, non-maleficence is going to cut off what options are suitable to the patient. Next, we have And autonomy is the patient's right to do what they want to their body. But this is there is a condition to this, in that the patient has to be competent enough to understand the treatment under their own condition to make that decision. And it's about autonomy, letting the patient choose, and you can't do anything if the patient says no. So yeah. And lastly, justice is just following the law and making sure that everything is fair and balanced. Usually, this is about how we would distribute the resources, the limited resources we have, to people. So sometimes, why do you allocate this much of money to that treatment and not the other treatment? And how do you justify that? How is that fair? So yeah, that's the 4 pillars of medical ethics. So just a short recap. Maleficence is doing what's best for the patient. Non-maleficence is not harming the patient. Autonomy is letting the patient choose their own treatment. And justice is being fair to everyone, to the larger population. Right. Now, moving on to ethical theories. Ethical theories aren't that important, I think, because usually having the 4 ethics is enough. But I find that knowing these ethical theories, which the medical theory from, helps a bit when you're what's right and what's wrong. So the first one you have is deontology. Deontology is about everyone having a duty, and then by performing that duty, you are doing the right thing. So in a sense, this, in another word, it would be actions have intrinsic right or wrongs. So for example, if you lie, that's a wrong thing. That's a wrong thing to do. So in any circumstance, if you lie, even if it makes someone feel better, if you lie, you are not doing the right thing. So over here, to make it easier to remember, deontology starts with a D. D is daddy. That's the rules. You must follow them. Right. Next, we have the picture of Immanuel Kant, K-A-N-T, Kant. He's a strong supporter of deontology and general knowledge. Next, we have now, utilitarianism is about getting the maximum benefit for the most number of people. So it's like, why would you give this treatment? If you can save, if you can use this amount of resources to save 2 people, and also the same amount to save only 1 person, then you will definitely use that resource to save those 2 people, because then you'll be saving more lives. So under utilitarianism, that is how it works. So over here, I would say, who gives you £5 to buy candy, and you should make the most out of it for you and your siblings. That's what utilitarianism is about. Lastly, we have virtue ethics, about the person as it is instead of the action. So if you are a good person, everything you do is good. Or you can say, if you follow what the person does, then you are doing the right thing. Over here, what I wrote is, Virgin Mary is a good person. Anything she does is right. And therefore, if you follow what Virgin Mary does, you are a good person. Right? Now, that is all with ethics. We are now going to do some roleplay. So, first roleplay is about breaking bad news. Gaeun and Padma will demonstrate this.
How are you to unmute?
How's your trip?
So wait, before we begin, should we just read out the scenario?
Oh yeah, sure.
Okay. Yeah. So the scenario basically is, your friend asked you to take care of her cat while she was on her holiday, and you accidentally forgot to close the front door, and the cat ran away and never came back. How would you break the bad news to your friend and that the cat is missing when she comes back from her holiday? So Padma that lost the cat, and I'm the friend that went on a holiday. Should we start?
Yeah. Hi, how was your trip?
It was really good. Thank you so much for asking. I had a really good time. By the way, where is Scruffy?
Well, about Scruffy, I have something to tell you, and it's bad news. Would you like to take a seat first?
Okay. What is this about?
I was looking after your cat and everything was going well. But last week when I came downstairs and I couldn't find Scruffy, I realized that the back door had been left open. I think Scruffy ran away and unfortunately I haven't been able to find him since then.
Oh no. Can't believe this happened. Oh, you're so irresponsible. How could you do this?
I'm really sorry. I know how you trusted me with taking care of Scruffy. I did my best to find him. I put up missing posters around the neighborhood. I went searching for him for hours.
I don't know what to say. I should have never trusted you.
I'm very sorry this happened. I know that you're upset with me. Is there anything I can do for you?
I don't know what you can do. I mean, Scruffy's gone now, and I'll never be able to find him anymore.
I feel terrible. I take full responsibility for this. Would you like me to continue putting up more missing posters around the neighborhood?
Yes, yeah, do that. And can you also ask more people if they've seen Scruffy, and maybe hopefully you can find him.
Of course, I'll do that, and I'll keep you updated on any news. I know Scruffy can never be replaced, but if we can't find him, then I'm more than willing to buy you a new cat because it's the least I can do.
Okay, that's fine. Okay, that's the role play, and we're just gonna go through the feedback about like why that was a good answer. So Padma, the most important thing is like the body language as well, and also the tone of the voice and how clearly you speak. So Padma was like she was really calm about it, spoke clearly, and she went straight to the point where like I have something to tell you, instead of going on and about like all the excuses. She went through, like she acknowledged what went wrong and like why the cat is missing as well. So, and then also Padma gave the time to her friend to really process what's being told to them and really actively listen to their friend, like instead of like interrupting, oh, but it's not my fault, it wasn't like that. She was clearly like it's honestly my fault, I'm so sorry, and like being really like sincere about it. And also she offered support. She said, I did this to help, like to find Scruffy. Is there anything I can do for you? Like he can't be replaced, but like I could help you, stuff. Which is really good because you're really giving that support to the friend. Yeah, and then like she did really well. She gave the warning shot that it's going to be a bad news, and which was kind of puts the friend into that, oh, like what's going to happen, that kind of thing. Yeah. So I think that's the role play done for this one. What's the next one? Yeah. Okay. Do you want to introduce?
All right, so the next one is this typical classic question: why do you want to study medicine or dentistry? Now we'll be performing both good and bad examples. Gaeun and I would be doing the bad example. I will be the interviewee, and Gaeun will be the interviewer. So, action.
Hi, Kong. Can you just tell me why you would like to study medicine?
Well, I always like to help people, and I find that doctors get paid quite well. And well, I'm quite inspired by my uncle because he's my childhood hero and he's a doctor, so I wanted to do what he does, what he's doing. So yeah.
Okay. So the reason why this is a really bad answer is that he also mentioned about he mentioned that he likes to help people, but there are so many careers that you can help people other than medicine. So you could, like, teachers help lots of people, nurse helps lots of people as well, but like you have to really show like why medicine that you want to do to help other people, and like what aspect of being a doctor really attracted you to become a doctor, and yeah, that you want to become a doctor. And also he mentioned about pay as well. Honestly, never ever mention pay during the interview. It's like the worst thing you could do. Pay should never be, like, money should never be motivator for any job. And if you're gonna mention pay, go for a different degree, I guess. And also, Kong also mentioned about that his relative is a doctor. You could mention this, but you need to show that you want to study medicine for yourself rather than for someone else. And so it's nice to mention if there are any like story or experience that really inspired you to become to wanting to become a doctor. Padma and Habiba are going to do a good example role play, so you listen carefully to what Padma's gonna say.
Hi Padma, so why do you want to study dentistry?
I feel dentistry is a profession that combines my love for the sciences with my passion for making a real positive impact on people's lives. I love the way that dentists are able to build a rapport with their patients that they see repeatedly over the years and really get to know them. And this is something that I look forward to doing. During work experience, I realized the massive impact that dentists can have on the self-esteem of people. When I saw a woman who initially was so self-conscious about the gap in her teeth that she wanted to avoid her nephew's wedding, but then after receiving a denture, she began tearing up, and as a result, she attended the wedding as well. And this really touched me, and I feel like it would be so rewarding to be able to have this kind of impact on people. Furthermore, I really appreciate teamwork, and I would love to work constantly with a range of other professionals. I also like working with my hands, and as quite a creative person, I think I would enjoy the practical aspect of dentistry, which often involves working intricately in the confined space of the mouth.
Okay, so that was a very strong answer from Padma, because she gave a very personalized example, specifically what traits about her align with the traits of a dentist, which is also what she mentioned. She also had a very enthusiastic voice. She had the right kind of, I know obviously it's hard to show, but the right kind of body language showing that she's engaged. And I think she really showed that she understood the role of a dentist and then used her own kind of traits and personality to show that why she's perfect to be a dental student.
Right, next, what do you think about euthanasia again? Gaeun and I will be doing the better example, and I will be the student again.
Yeah.
Right.
So, what do you think about euthanasia?
I'm not for euthanasia because all life matters, and I think euthanasia would weaken the society's respect for human life. And also, you never know when people would change their mind about killing themselves. So I don't think it's a good idea to legalize euthanasia. Also, euthanasia, then it would discourage the search for new cures and treatments for people with terminal illnesses. So I don't think that's a good thing.
Okay, so this is not the best answer because, like, ethics question, it's really vital to show the awareness of views for and against the argument that's presented. But here, Kong only was sticking to his view, how the euthanasia is bad, and it's as a doctor, it's your personal beliefs and views are often overridden by the patient's choice or by the law. So it's really important to present a balanced argument regarding these kind of like ethical debates. So yeah, Padma's gonna be talking about the good example. So yeah.
So hi Padma, what do you think about euthanasia?
So euthanasia, by definition, is the act of deliberately ending someone's life to relieve their suffering. Since this is an ethical decision, I think it's important to consider the pillars of medical ethics. So firstly, I'll talk about autonomy. So some say that it should be the patient's right to choose if and when they want to end their life. However, this can be complicated if the patient has a mental illness, and it's sometimes challenging to determine competency. There can also be external factors involved, like pressure from relatives to request euthanasia, and the patient might feel like a burden on relatives if they are dependent on them, and thus may request euthanasia out of guilt. So in these cases, it can be difficult to say whether the patient has made this choice through its true autonomy. Additionally, a right to die would mean a right to kill, which some would say gives too much power to doctors, and it could be misused. It could also interfere with the autonomy of the doctor if they do not wish to administer euthanasia, but it's legal where they work. Next, I'll talk about beneficence. So this means that doctors have a duty to do good. Considering euthanasia, some would say that doing good means ending suffering, whilst others may see doing good as caring for them till the end of their life and showing them that their life is valued. Non-Maleficence, which means to do no harm, which is another pillar of medical ethics, could mean to some that doctors should not support euthanasia since this would be harming the patient. But others may believe that seeing them suffer a slow, painful death is doing harm to them, and so euthanasia should be allowed. Apart from this, if you look at it from an economic perspective, it's expensive to keep people alive when there is no cure for their illness. So euthanasia could mean that precious resources could be used to treat those who could live. And on the other hand, allowing euthanasia could reduce the drive to search for new cures. And some people unexpectedly recover, and euthanasia could weaken society's respect for the value of life. But overall, several of the pillars of medical ethics like autonomy, beneficence, and non-maleficence can be used to justify euthanasia as well as argue against it. But in the UK, euthanasia is currently illegal.
Okay, so that was a very strong answer from Padma. It was a very well structured answer in the sense that she started with defining the term, she based it on the different pillars of ethics, and she made sure to kind of use both sides and have a very balanced argument. I don't know if you noticed, but she also didn't come to a conclusion, which is completely fine with these ethical scenarios. They don't expect you to have a clear-cut answer because even fully qualified doctors don't. So in this sense, I just want to assess your critical thinking, how you're able to show both sides and just ensure that you can kind of think of different perspectives regarding the question.
To give you some overview about how to prepare. So 3 P's. So the first P is pre-reading. As mentioned previously, really research into unis and like about the interview types. And also I would advise you to make about 2 to 3 bullet points on each, on key facts about each uni that you can maybe perhaps bring it up during the interview. And also do some pre-reading about any that we're actually going to be giving you some examples on hot topics later, so so stay seated. And then also make sure to review your personal statement, work experience, and EPQ if you've done it, because during some interviews, some interviewers might have your personal statement in front of them, and then they might ask you questions about your personal statement, so you really need to know it inside out. So the next step is to predict. Search up some common questions for your medical and dental interview. There will be loads on the internet, so do check it out. And for each question, make some draft answers. My tip would be to make around 5 bullet points for each question instead of writing word for word script, because trying to memorize a whole script for each question would take too long and it wouldn't really flow very well. So stick with bullet points, and when coming up with an answer, take your time, really answer truthfully, be yourself, be personal, but then also be confident, because you don't want to be too humble, because you're there to tell the interviewers how you're the best candidate to become a good doctor or a dentist. So the key point here is to really familiarize yourself with a lot of questions as much as possible. So the last step, the last P, but the most important step is to practice as much as possible, like practice. Even if you come up with the most amazing answers to the question, if you can't really convey your points to the interviewer because you're waffling or you're too nervous, it would be really meaningless. So to familiarize yourself with your answers, practice as much as possible. And I would advise you to practice with different people. So it could be with your parents, family, friends, maybe your teachers, or just really random anyone. And also receive constructive feedback. Find out what went well and how you could do better for the next time. And I would say also to practice in front of the mirror, or actually just record yourself answering to a question, because this would really help you to spot any body language issues, or whether you're spending questions. So like it's really good to time yourself as well, because you don't have hours and hours to talk about yourself. And yeah, so be concise, clear about your points, and keep it to the time. And make use of any resources if possible. So like if there are any mock interviews, do join them. Even if you're shy, just go for it. and also just use any useful websites and books to practice your interview.
Topics and notable cases. These are just a list of things that I thought that it's likely to come out, but they can seriously ask you anything. So feel free to take a picture of this list and go research it on your own time. I do think that it's useful to read around a lot of cases because then you can use them as a parallel to compare to the actual ethical scenario they give you on the interview day. So yeah, it's, you know, go read it up. What I want to tell you about is how to actually analyze these topics, which is more important because seriously they can and, you know, being able to think is better than just, you know, being prepared. So next slide, please. And next. So you basically just apply the 4 pillars as what Padma did just now in the role play. Apply the 4 pillars, and then you'll be surprised how you can talk about when you apply the 4 pillars, because sometimes certain pillars will conflict together, and then sometimes you'll emphasize more on certain pillars, and then you have to make a certain trade-off on another pillar. So, you know, play around with that, and will have a really long answer. Now, I do appreciate that during the interview you might get nervous, so sometimes it's useful to have another way to think about these questions. The one that I like to use is this, whereby I first think of the individual patient and then move out to how this issue might affect patient's family, and then finally how this issue would affect the society as a whole. You know, it's ethics. There is really no fixed way to discuss these topics, but having a framework would really help you to keep track of your own ideas and make yourself sound coherent, and that the listener will understand what you're saying. So yeah, that's it from me.
Now, to general advice for the day. So first and foremost, this is just standard. Make sure you get enough sleep. You don't want the interviewers to think you're tired. So just make sure you're completely ready for the day. Remember to take a moment to pause during the interview if you need it, to think of your answer. Interviewers would much rather a cohesive answer to the question rather than something that's haphazardly thrown together in the spur of the moment. And as Padma previously went through, use the STAR method. It's a great way to structure your answers and make sure that you hit all the different checkpoints that they have on the little mark scheme. Make sure you dress smartly, you have good posture, avoid slang and informal language. Remember to smile and maintain eye contact. Non-verbal communication is a big must, especially for virtual interviews, so make sure you're aware of that. Be confident but not arrogant, so you do want to show that you've got a lot to offer, but just there's a fine line between arrogance and confidence. And for ethical questions, just make sure you prioritize patient safety and the 4 pillars of medical ethics, and just make your responses as personal as you can. Using your own examples is perfect for these kind of questions.
So these are some resources up on the screen. Of course, you can come to our event, SAMDA, but up on the screen, there's like other companies that provide like free resources that will help you with your interviews. If you prefer doing it like learning from books, you have the medical school interview guide, and also like YouTube. I used Ali Abdal's ethics series, where he goes through what Kong kind of did, but obviously the videos are in much more in detail. Okay, so that concludes our talk. Thank you all for attending. We hope you have enjoyed yourselves and gains a bit of insight into interviews. And on behalf of SAMDA, we would like to thank the organizers and all the team behind the Virtual Health Careers Conference for giving us the opportunity to deliver today. So on the screen, you can see our QR code. If you scan it or alternatively type out the box link, it will take you to a feedback form, and we'd really appreciate it if you can give us some feedback so we can improve our delivery next time. I'm aware some students would like the PowerPoint slides. What I'm trying to do right now, I'm going to download as a PDF and attach it at the end of the feedback form. So once you submit it, you should have a link to the PowerPoint slide, and I'm going to do it right now. And that's our social media up on the screen. Do follow our Instagram and subscribe to our YouTube channel. And yeah, we'll now move on to the questions. Gaeun, if you want to start taking questions, and then I'll sort out the PowerPoint slides.
Okay, first question we have, A levels are best for medicine and dentistry. Well, for medicine, as far as I know, chemistry is a compulsory subject. Everything else is fine, except some medical schools would require you to have another science subject. So chemistry is a must, one more science subject, and some other thing that you like. And Gaeun or Padma, would you like to take that?
So for dentistry, I think biology and chemistry, most universities ask for both of these. I think some universities don't mind if you don't have chemistry, but you have maths or physics instead. So I think it just depends on the university, but most of them do look for biology and chemistry. So just, research what unis you want to apply to, and usually it says on their website what they're looking for. Maths is not necessary for medicine or dentistry. Yeah, it's not necessary, but obviously it shows that you are like a competent person, but I think you can show that through other A levels as well. But basically, if you go on their website for most unis, they'll have a list of what you need.
Are students likely to be asked about ethical theories in interview? I would say not very likely. It'd be more about how you apply. They won't even ask you if you know the four pillars of, but they would be more interested in knowing whether you know how to apply the four pillars of medical ethics. So again, having the four pillars is more than ethical theories is just a supplement. So if you don't want to know about that, it's fine. Is medical ethics similar to dental ethics? I have no idea. Would the dentists like to help me answer this question?
Okay, so
Sorry.
Yeah,
Padma,
so
can you take this? Yeah.
Yeah, sure. Dental, so yeah, it is similar. Like what Kong said is pretty much irrelevant for dentistry as well. But it's not like you don't have to learn any sort of dental ethics for the interviews, so don't be like too worried about that. It's mostly just, as I said, if you know about the key organizations like the GDC and what their principles are, like I think that's like enough for the interview. And for the interview. So.
Right. Thanks, Padma. Right. Lastly, we have, are role plays like this likely to be in MMIs? Thanks. I would say role plays are quite likely to appear in MMIs. I did quite a lot of MMI interviews because I keep getting rejected, but I think every single MMI that I've been to, I did have to do at least one role play. Sometimes they would have two, so it really depends, but it's quite likely. So but honestly, these interviews are just to see if you're a psychopath. If you're a good person, you are definitely gonna pass that interview. So chill. Question about and what to include in the personal statement. I would say refer to the SAMDA posts because we are not really covering that today. Sorry about that. When is the best time to start preparing for interviews? I have no idea. I would say maybe 2 weeks before the interview is enough time, but I don't know. Would anyone else like to give some input?
Yeah, I agree with you, Kong. At 2 weeks, I don't spend any more. Some interviews tend to be during the Christmas holidays, so there's perfect time to get kind of undivided attention to interview prep, but any more than 2 weeks would probably be too much. I wouldn't stress too much about exactly the time period. It's more about like what you can get done in those couple of days or those 2 weeks beforehand. So try not to stress about the actual quantity.
Okay, for graduate and medicine. Not from me because I'm undergrad. Anyone has an answer to this?
Input. So as in SAMDA we have graduate JEP reps basically, and if you contact us via our email, if you have any questions, we can pass the questions on to our JEP reps and they'll be able to get in contact with you. Alternatively, if you fill out the feedback form at the end, there's the application guide and we have a JEP section. So I hope that helps.
Next, is English literature a like subject by universities? I honestly don't have the answer to that. Does anyone know? But okay, if you're asking what subjects you should like, what subjects is a good combination for medicine and dentistry, honestly, you just have to. To me, you just have to get the minimum requirements. So chemistry, A star in chemistry or something, or A in chemistry, and another science subject and something else that you want. So I guess English literature can be quite useful when if you're gonna do lots of essays in that particular university. So for example, in BARTS, we have to write essays, which will then contribute to our end of year results. So I guess if you have an English literature for A levels, it's probably going to help you. So and just enjoy your A levels, really. That just meet the minimum requirement of the university and you're set.
Can I add to that as well? So some universities, it's like as what Kong said, try to meet the minimum, and then if you're kind of if you don't want to do math and if you're looking for something else, so dentistry, you could possibly do something that's like hands-on stuff, so like art or music. So because dentistry see a lot of like manual dexterity, which is like how the ability to move your hands really well. So if you do art and then or like music, so like musical instrument, you could also mention that. Through my art A level, I've gained lots of improved my manual dexterity, and I would like to apply this skill in dentistry. Like you could also mention it in that kind of way for dentistry. I think that's kind of similar for medicine. I don't know.
Thanks, Gaeun. I agree. Okay, next question. Based on the ethical pillars, how can you evaluate mental illnesses and crime? Say if they commit a long jail term crime. I am not very sure what you mean by this question. Does anyone want to answer this? Or could you rephrase it in another way? I'm just going to skip this one first. Okay, how did you know you wanted to go into dentistry rather than medicine? Oh wait, sorry. You mentioned hot topics and other major events that seem to be relevant to medicine. Would there be anything for dentistry for interviews? Dentists?
So for dentistry, I think in some universities, in the interview, they give you like an article to read about a current, like a hot topic in dentistry, and then after that they ask you what you thought about the article, whether you supported any of the points that were made, whether you have any other points. So usually if they do want to ask you about that, then they might have that like in the interview. But if not, then they might just ask you about if you know any current events in dentistry, like in the news. So if you just keep up to date with any, like news, then you should come to know about any hot topics. But yeah, it's not really.
And how did you know you wanted to go into dentistry rather than medicine?
Okay, so dentistry, like I always liked in dentistry how you could see immediate results. So what I mean by that is during work experience, or even like before work experience as well, like when I used to go to the dentist myself, I just always loved how in that appointment, like in that short appointment, you know, however long it is, someone can get a filling done, someone can get their tooth extracted, and it's like you can literally immediately see the results of what you do. And I just thought that just, you know, really appealed to me. And as I said, I really like the creative aspect as well, about the hands-on aspect, which is perhaps not to the same extent in medicine. But yeah, I think if you're unsure, then doing work experience really helps. So maybe if you want to do work experience in a dental practice and in a hospital or GP practice, then you can compare them and see which one you feel you're more interested in.
Someone asked, how do we apply for interviews? You don't apply for them. So you apply to medical school via UCAS, and then they select you for interviews if you meet the criteria. So for example, at Barts, I believe they look at your UCA and GCSE in the 50-50 ratio, and then they basically shortlist people for the interviews and then interview them, and then again shortlist for the offers.
Okay, thank you so much. That was really, really insightful. I hope everyone enjoyed the session, and I hope everyone got their questions answered. If the participants watching would like to go to another session, the tabs on the side. For the speakers in particular, would you like to go to the speakers lounge just for a little debrief with one of our team members? Again, thank you for your time, and yeah, have a good day, everyone. Thank you.